In this video, I will be demonstrating the Prescriber Progress Note with e-prescribing access to the updated Rcopia4 e-prescribing environment. The Prescriber Progress Note is comprised of two main work areas, Part 1 and Part 2. As with other notes, you will begin top to bottom and work left to right through Part 1 before transitioning to Part 2. If the client is doing well, utilize the All Normal button to indicate so, which will also indicate a normal mental status exam. Otherwise, start with Clinical Status and Complexity, which covers your medical decision-making. When navigating between individual work areas, you may see a Back button. When finished with a particular section, clicking Back will return you to the main work area of the progress note. Next, you will work your way through symptoms. As you click on each button, referred to as our shrub content, text will populate into the note for you, but you can free text into the yellow work areas as needed, or utilize custom button content created by you or shared with you by other clinicians and providers. Custom buttons are interspersed throughout the work areas of the note. Continue down the left side of the progress note into Review of Symptoms, enter test results, note behavior, document immunizations and screenings, and if needed, access the PFSH to review past psychiatric family and social histories. To the right of the note, you will document side effects as well as drug reactions, which include both allergies and adverse drug reactions. Next is psychotherapy, rating scales, and the mental status exam. Moving down the right side, you'll note vital signs, or use vital signs previously taken by the nurse, as well as pain, coordination of care, and course during treatment. If needed, you have the option to link an existing treatment plan to this progress note, providing brief updates as to the client's progress with treatment. Private notes can be entered below and will not print with the narrative in the final compiled note. Private notes are not considered part of the official record and are for clinicians' use only. When ready, click to proceed to Progress Note Part 2. In Part 2, work in order through each numbered section, starting with medications, instructions and recommendations, diagnosis, and so on. For e-prescribing clinicians, click Go to e-prescribe to access Dr. First Rcopia4, where you will review the patient's summary, including current medications, allergies, diagnoses, and any pending prescriptions. Click to create a new prescription and search for the drug to be prescribed. As you type, related options will be displayed below the field. Simply click on the appropriate option to continue, then click to set the dosage. Using the drop-down fields in the Prescribe Medication widget, you'll complete the SIG and all related details for the medication you are prescribing, including day supply, quantity, and any refills or directions to the pharmacist. Click Review to proceed. Here you have numerous options of how to handle the prescription, whether you are sending it to the pharmacy now or adding it to the client's active medications. When finished with all e-prescribing for the client, click to go back to Iconotes, located at the very top left corner of your screen. When returning to the progress note, your mouse and keyboard will be momentarily unavailable as Iconotes downloads medication updates from Dr. First. Move on to additional areas as necessary, including diagnosis, therapy content or clinical summary, entering a service code, or, if you're enabled for auto-coding, selecting the E&M Code for Me option to score the highest reimbursable code. Note the time spent with the client and any authorizations required for the session, followed by Justify Level of Care and any follow-up. When finished, you have three options for saving your note: Save as Progress Note, Compile Note as a Complete Evaluation, or Compile Note as a Final Exam and create a Discharge Summary. Following your selection, you will be taken to the finished note. Here you have additional options, such as electronically signing or capturing a signature via mouse or signature pad. To the right, additional buttons will take you to patient accounts, create a clinical or discharge summary, or you can change the note title to give it a more specific title and/or subtitle. You can make final changes to the completed note by free texting into the left-hand field. However, please note that any changes here will only be present within the final note and will be lost if you later return to the work areas to make further changes or updates. If so, it is always a great idea to electronically sign the note again following a recompile. When finished with the note, click to return to the client's chart face or go straight to the chart room.